Hi everyone, we are presenting the over-the-counter treatment options for constipation. Constipation is a GI condition characterized by having less than 3 bowel movements per week. The bowel movements consist of hard, dry, or lumpy stools that are difficult to pass. It is often accompanied by symptoms that can include pain, abdominal discomfort, and a sense of incomplete evacuation. Constipation can primarily be managed by non-pharmacological measures through increased fiber intake in the diet, adequate hydration, and limited caffeine intake and regular exercise. It is important to let patients know that daily bowel movements are not required and that frequency does vary among individuals. There are overall about 70 to 80 over-the-counter products available to treat constipation. And the 5 classes that we will be discussing include bulk-forming laxatives, osmotic laxatives, stimulant laxatives, emollient stool softeners, and lubricant laxatives.
The bulk-forming laxatives work by absorbing water in the intestines, which increases fecal mass, stimulates peristalsis, and decreases transit time to promote regular bowel movements. And it is important to monitor for medication's therapeutic effect. The choices of bulk-forming laxatives are psyllium, branded as Metamucil, methylcellulose, as Citracil, and calcium polycarbophil, branded as Fibercon. So each of these has unique formulations and side effect profiles, such as drug-drug interactions. Psyllium can decrease absorption and effectiveness of carbamazepine and lithium, and induce hypokalemia if taken with licorice laxatives and antidiabetics. For methylcellulose, taking with dichlorphenamide can cause hypokalemic effect. For calcium polycarbophil, calcium salts can cause toxic effect with calcium acetate, decrease therapeutic effect of calcium channel blockers, and decrease serum concentration of bictegravir. For special populations in pediatrics and during pregnancy, bulk-forming laxatives are generally safe. Psyllium and methylcellulose can be used in children with careful dosing, and all 3 options are typically safe during pregnancy if taken with adequate fluids. The daily cost of bulk-forming laxatives is from 16 cents to $2.40, which is about maximum of $17 for a week administration, depending on a product.
All right, then with osmotic laxatives, the primary mechanism of action is that the active ingredient draws water out of the gut, which then softens stool so that it's easier to pass, creating softer, more frequent stools. Or if it's a suppository enema formulation, it helps break down the stool so that it's softer and again easier to pass. With this, we want to monitor for the therapeutic effect and monitor any changes to the electrolytes. A very common osmotic laxative is Miralax, also known as polyethylene glycol 3350. It usually comes in a powder form that can be mixed with any clear beverage. Across the board, you want to avoid licorice laxatives and then monitor for electrolytes with the increase in frequency in stooling using this medication. With the magnesium-based laxative, magnesium citrate and magnesium hydroxide, they're both something that a patient can drink, and it is important to dose appropriately to avoid hypermagnesemia. Magnesium can also have an antacid-like effect, which can impact absorption of other medications. And additionally, I want to point out that there is a pointed out interaction between IST-HIV medications. And with glycerin suppositories, they are fairly safe due to their limited systemic absorption and can be great quick-acting options for impacted stool. Same with saline enemas, which also help decrease stool burden. They have a generally low systemic absorption. However, it is important to keep in mind that they can have a strong interaction with QT prolonging medications depending on how much is absorbed. And across the board with all these medications, we're monitoring for bloating, cramps, nausea, and abdominal pain, all of which are normal findings. For special considerations, Miralax is actually not FDA approved for children under 17 years old, but it is very commonly used. It is a pregnancy category C, and magnesium medications are not recommended for those who are pregnant for concern of the medication crossing the placenta. The glycerin suppositories and saline enemas are both good choices because of their limited systemic absorption and can be quite cost effective. And then with Miralax, if you consider that you're taking 1 dose weekly to assist your constipation, it can be about $4.20 for a week.
So stimulant laxatives work by stimulating peristalsis, either in the small or large intestine. They also increase the amount of water in the intestines. When we're looking at stimulant laxatives, we want to monitor for bowel movements, and if there are symptoms of electrolyte imbalance, we'll want to check a CMP. Next slide. There are three main drugs within the stimulant medication class. All of these have similar adverse effects, including general GI symptoms of nausea, vomiting, diarrhea, abdominal pain, and cramping. All of these medications also interact with licorice, resulting in hypokalemia. Bisoprolol acts by stimulating sensory nerve endings and comes as tablets, enemas, and suppositories. Important patient education includes not drinking milk within an hour before or after administration. Drug-to-drug interactions include polyethylene glycol, electrolyte-containing medications, and H2 blockers. When we're looking at the senicides, so Senna, Senecot, and X-Lax, these come as oral tablets, chocolate chews, and oral liquids. These can cause electrolyte disturbances, so it's important to monitor electrolytes when using these for an extended period of time. Additional drug-to-drug interactions include polyethylene glycol, potassium sulfate, and digoxin, with a risk of digoxin toxicity. We also have castor oil, which comes as a liquid oil that can be mixed with water, juice, or carbonated beverages. This can be chilled, but should not be frozen, and it should be taken on an empty stomach. Castor oil has the same side effects as the other medications, with the addition of possible blistering and sloughing of the skin of the buttocks if diarrhea is induced. Drug-to-drug interactions include QT prolongation with droperidol and levomethadol. We can move on to the next slide. So when we're talking about special populations with Biscodol, there is no evidence for use in pediatric use, and it's not recommended in pregnancy or lactation. Senna can be used by children over the age of 2, and there is minimal risk of pregnancy or lactation. Castor oil can be used in pediatrics, and there are specific dosing based on age. Castor oil is used off-label to induce labor, so it should not be used in pregnancy. For lactation, infant risk cannot be ruled out, so alternatives may be safer. If we're looking at weekly dosing, say for Senna, that's going to cost us anywhere between 50 cents a week and $24 a week. The other medications may be dosed daily.
We'll now review emollient stool softeners. The general mechanism of action for these drugs is they draw water and fats into the stool, which in turn softens the stool and helps with elimination of bowel movements. When looking at monitoring, we typically are looking at the therapeutic effects within 12 to 72 hours is kind of when we typically expect to see these effects take action. We also want to look at cardiac abnormalities, specifically heart palpitations, dizziness, and fainting. Reviewing emollient stool softeners, the active ingredient for this class of medication is Dococet. This usually is sodium or calcium. There's also Senna Plus, which is an oral tablet, which is a combination of a stimulant laxative and a stool softener. There are multiple formulations of this medication, including capsules, chewable tablets, and it also comes in liquid forms or enemas. The most common side effects experienced when using these stool softeners tend to be abnormal taste in the mouth, bitterness, diarrhea, nausea, and cramps. In serious cases, we can see hepatotoxicity, so it is advised to use with caution with patients with liver disease or liver disorders. Some of the drug-to-drug interactions for these medications that can be severe include levomethadol, which can result in QT prolongation, or licorice, which can result in hypokalemia, and droperidol, which can result in cardiotoxicity. These medications should be used in caution with mineral oil as well, as patients can have increased risk of inflammation of the liver, spleen, intestinal mucosa, and lymph nodes. When looking at the special populations, Colace is considered safe for pediatric and pregnant patients. However, during lactation, risks for infants cannot be ruled out. When we also look at the cost for these medications, they are dependent upon the amount of medication and whether it is a generic store brand versus a name brand. Typically, these costs range from 70 cents to $3 a day, or $2.40 to $21 for a week, which is the maximum recommended length of treatment before discussing this further with a provider.
In the last over-the-counter drug class we will discuss is lubricant laxatives. Specifically, they do their job by coating the stool and intestinal wall, as well as decreasing colonic absorption of fecal water. And overall, lubricant laxatives work to ease the passage of stool. So we will monitor for therapeutic effects to ensure the patient has a bowel movement after use. And specifically for this medication, we will also watch for respiratory complications, such as shortness of breath, difficulty breathing, and a new cough, which will be further discussed on the next slide. The only over-the-counter lubricant laxative available is mineral oil. There are a few generic and brand names it is sold under. It's available in 2 formulations. The first formulation is an oral liquid that should take effect in 6 to 8 hours. The main side effect of the oral liquid is lipid pneumonia with aspiration, so we want to ensure our patient is able to swallow effectively prior to administration. This side effect is why we will monitor for any signs or symptoms of respiratory complications. Additionally, you want to separate administration at least 2 hours with multivitamins and meals, as it will prevent absorption of vitamins A, D, E, K, folate, and iron. You also want to caution with concurrent administration with DocuSate, as Matt already touched on. And then you'll have the enema, which should take effect in 5 to 15 minutes. You want to notify your provider if it does not, as you may have an bowel obstruction. And it's generally well tolerated, but not normally taken as a first-line medication. And it does cause GI symptoms such as nausea, vomiting, and abdominal pain. Other considerations, you want to avoid this in pediatric and elderly, specifically if they're under a year old or greater than 65, due to increased risk of aspiration, causing that lipid pneumonia. There are some dose adjustments in children that you want to make sure you take careful consideration. And we do not use this in pregnancy or lactation due to the decreased maternal absorption of fat-soluble vitamins. Overall, mineral oil is very affordable. Oral formulations have multiple doses per bottle, as enemas are generally sold as a single dose. Oral formulations are typically a one-time dose and are not to be used more than 1 week. The cost can average anywhere from 50 cents to $2 per dose. And enemas are sold typically as a single dose, and they can be $3 to $5.
Medication safety issues for laxative use and abuse include electrolyte imbalances, which can lead to a variety of issues, including cardiac complications, mineral loss, which can lead to softening of bones and bone pain and a variety of side effects. Long-term use of laxatives can also lead to dependency in the long term, which can cause anatomical changes in the colon. Prevention and treatment methods include assessing for use and abuse, and then stopping the medication if it is causing issues, replacing lost electrolytes and minerals, and for laxative abuse related to eating disorders, connecting patients with appropriate therapeutic support. Prescription options are used when over-the-counter treatment is insufficient, and prescription options include peripheral opioid receptor antagonists, osmotic agents, serotonin agonists, and secretagogues. Thank you for taking the time to listen to our presentation.